Hi, my name's Craig Spears. I'm 39 years old. I'm a husband and father to two beautiful children, Adam 3 and Rhiannon 11. I have been living with neuroendocrine neoplasms for 6 years. My primary is in my rectum with mets to my liver and abdomen, and I have both severe carcinoid syndrome and carcinoid heart disease. I'm currently an ambassador for the Net Patient Foundation, using the patient voice to raise awareness and understanding for this uncommon cancer. My story doesn't start at my diagnosis. It starts 3 years earlier when I've been suffering with nausea, fatigue, diarrhea, stomach complaints and heart palpitations. I made several visits to my GP over the 3 years. They looked at various ideas as to what was wrong with me, but we were never able to find a diagnosis. I remember my last visit at the GP practice where I complained again about the same issues, but also explained that for no reason I'd been flushing on a regular basis. The GP tried to explain that this was stress from work, told me to calm down and that he couldn't find anything wrong with me. My reply was that I was watching cartoons with my child, so I didn't feel stressed at the time, and I decided to leave that GP and join the same practice as my family. On my first appointment, I explained what had been happening for the last 3 years, and I was beginning to feel like something was not right with my health, as the flushing was getting worse. My GP was calm and asked me to complete a simple 24-hour urine test. At the time, I knew nothing about what this would tell me, or the road it was about to lead me down. The next few months went by fast, as I had an MRI scan, CT and ultrasound scan. I can't explain why I hadn't asked these questions at the time. I just went for the scan and carried on work, until I finally got a letter asking me to see a consultant at the local hospital. I remember this day vividly. I went to this myself, something I'll never allow my friends or family to do. I was sitting in the waiting room, watching patients leave after their appointment, and I was the last person sitting there. I was called into the office, and as I sat down, I looked round and I noticed a nurse had followed me in. She sat next to me, and I looked at her face, and I instantly knew that this was not going to be good news. The consultant explained my diagnosis as best he could, but confessed he was not an expert in this field, and I'd be sent to the Beatson for treatment. My whole world had just fallen apart. I stopped listening to the nurse and doctor, and I just blurted out, "I can't do this, I need to go," and I left. The next week was spent speaking to friends and family. Tears were shed, and I can honestly say this was one of the most emotional periods of my life. I say to newly diagnosed cancer patients that in the first 12 months, you'll have more support than you'll ever require. This support is overwhelming, but like everything, it can't last. Life moves on, and people try to support us as best they can, but sometimes don't know what to say to us. I was due to marry my fiancée in 1.5 years, so we decided that why wait, and we rebooked our wedding for 10 weeks' time. At that point, I had no idea what the future held for me, but I knew whatever it did, I wanted Angela by my side. So on the 15th of February 2014, Angela and I got married in the Beardmore Hotel in the company of family and friends. Angela was beautiful, and for one day we forgot about the diagnosis and spent a beautiful day celebrating. We often forget that this is possible, to have a life after diagnosis. This is something I wasn't going to let happen, and we have tried to make memories at every opportunity. We decided that our little family wasn't complete. So fast forward to July 2016 and little Adam was born. This is a major decision when you're a cancer patient, continually going through treatment. I can honestly say that both my children bring so much joy to my life that this was one of the best decisions we have ever made. I've become a stay-at-home daddy, looking after my kids. This has been one of the more positive aspects of my cancer diagnosis, that I get to spend so much time with both my children. My first meeting was with Professor Reid. He explained to me my diagnosis and the options I had for treatment. It was also explained that he couldn't cure me, but he had a bag of tricks that he hoped would give me a quality life for some years. I took this as a positive. We have options, and I've tried to keep this attitude through my treatment for the last 6 years. A cancer diagnosis is a traumatic period in a person's life. The uncertainty and lack of control is difficult to deal with. You need to be mentally strong when living with NENS. It'd be far too easy to allow negative thoughts to consume you. In the beginning, I really struggled to discuss my feelings, trying to protect those around me, appearing to be calm and controlled, while inside I was scared that this was my time. I had no knowledge, and the only person I could speak to was my oncologist, who were bombarded with questions every time we met. Thankfully, a nurse specialist was added to my medical team, Irene Witherspoon. She's been invaluable, helping me understand and make sense of this complicated life. Irene is everything a nurse should be: knowledgeable, kind, a good listener, but most of all, she makes time to care for each one of her patients. When I met my oncologist, he told me he had a bag of tricks to keep my cancer at bay. I think in the last 6 years, we've used all of these tricks and some new ones. I've had 4 hepatic artery embolizations. It's a treatment in my liver using the hepatic artery to block the blood supply to areas of my liver, starving the tumours. I've been on somatostatin analogues, sandostatin LAR, injecting every 4 weeks and then every 3 weeks, and stopped this due to large lumps under the skin. I had my gallbladder removed due to a large number of stones. I've been on a clinical trial called the TALENT study using the drug lenvatinib and stopped that after 12 months due to progression of the cancer. I've been on a 24-hour infusion of triotide using a syringe driver for a year, and I stopped that as I started PRRT. I've had 4 treatments of PRRT using the drug lutetium-177. I completed this, but it was not as successful as we'd hoped for. I used the drug telatristat to control the diarrhea. It's cut my bowel movements from between 10 and 15 to maybe 5 or 6 a day. I had open heart surgery to replace my tricuspid and pulmonary valve. I'm now currently on the drug lanreotide, and I currently inject daily with triotide between 4 and 8 times a day to control the flushing. I want to explain to you what life is like for a patient at the advanced stages living with this cancer. One of my main issues is flushing. When I talk about this, people don't understand how debilitating the flushing can be when at the severe end. I flush 15 to 20 times a day, sometimes more. This is not just a red rash on my face or neck. I'm talking about a full body flush. My feet ache with pins and needles. First my face turns red, then my whole body flushes. My hands and face swell, I feel dizzy, and I struggle to breathe. I have too many triggers to list, but to give you an idea, a simple task like getting showered and dressed in the morning will cause me to flush several times before the day has even begun. This is exhausting. People, even nurses, think it's funny to say you're like a woman on the menopause. But it's due to this flush I've damaged my heart valves, which have needed surgery. I also suffer with diarrhea. Many people will suffer in silence. Initially, I was too proud to explain how bad things were. I might go 10, 15 times a day, often with no real warning. I can sometimes feel trapped in my home, as I'm ashamed that I had to take a change of clothes the same way I did for my 3-year-old son. An echocardiogram done when I started a trial for lenvatinib showed regurgitation on my tricuspid valve. At this point, I don't think I'd ever known about carcinoid heart disease. This was frightening. How could my heart be damaged and me not know? I didn't feel any different, and I was still trying to learn to live with cancer, so put a brave face on and continued with my treatment. Fast forward 18 months, I'm off the trial and I'm preparing for PRRT. I was sent to a cardiologist when another echo showed damage to both tricuspid and pulmonary valves. To stabilise me for surgery, they decided to continue with PRRT. I remember the day I realised the severity of my heart problems. I was at a wedding, had no energy, was breathless, with swollen legs, and another echo confirmed I was now in heart failure. Both my tricuspid and pulmonary valves needed replacement now. I had only 2 PRRT, but they scheduled me for surgery. This was an extremely scary period for me. I could live with cancer, but having your heart fail makes you feel the worst. The 5th of February 2019, both valves were replaced. Waking up and seeing my family was amazing. I wish my story stopped here, but unfortunately it doesn't. As I've continued to flush, we expected I would damage new valves in time. I had a follow-up scan 6 months after surgery, which showed regurgitation on my tricuspid valve, and I will again need surgery. From a simple red face to heart surgery, who would have thought that? This cancer journey is a constant mental battle for me and my family, a roller coaster of emotions and a journey that sends me new challenges each day. I have a young family who have watched me go in and out of hospital for the last 6 years. We had to explain this chaotic life in a way they both understand. We explained Daddy has a monster in his belly and that I visit the doctor or nurse to put that monster to sleep. I'm a young father trying to live with cancer and have the same normal life as everyone else. I joke with my medical team that I'll live until I'm 80, that cancer won't beat me. This is a challenge for me, I know. Who lives with cancer for 47 years? Well, I will. 6 years ago, I thought my life was over. But thanks to the treatments over the last 6 years, I'm still here. Like so many other patients, I just want the normal life back that so many people take for granted. I just want to see my son and daughter grow up and get married and hope one day be lucky enough to see my grandchildren. I want to return to my career. I'm not ready to give up at 39. I make memories with friends and families as I now realise that the most precious item we hold is time. Once it's gone, we can't buy anymore. But I love life and I ask you to continue this fight for better treatment so I can have more memories like these.